welcome to Wine Time with Women.
For women.
I'm Melanie.
And I'm Cheryl.
And I've been a registered nurse for 12 years. Most of my career has been spent in obstetrics, doing labor and delivery. Over the past few months, I've transitioned over into the gynecological side, working for OBGYN practice. And trust me, there is a lot of stuff just gynecologically that need to be covered and people need to know. So, Cheryl?
I'm Cheryl. I've been in the OBGYN field, well, mostly OB, for about 17 years. I was a labor and delivery nurse for what seems like ever. And then I decided to become a midwife. So I've been a midwife for a little over 3 years now. Midwife, certified nurse midwife, is a midwife that has a master's degree, a minimum of a master's degree education. We do well women visits, vaginal infections, birth control, IUDs, and we deliver babies and do prenatal care.
And as a registered nurse in labor and delivery, while you're inpatient in the hospital, we manage your labor process. Doctors give us directives and we follow them. The main goal being to get a baby delivered safely and efficiently. I love being a labor and delivery nurse. It's the best job in the world. And I also love working now for a gynecological office with the obstetric side. As in an office is completely different than what you do in the hospital. So it's been a really great experience. It's been a very educating experience. And we look forward to sharing a lot of those things Cheryl and I have learned with you, because the whole point of the show is for you to understand your body, and most women do not. And I know that because of the phone calls I get day after day, and the questions that Cheryl gets day after day. Women, for some reason, have never asked the question that everybody wants to ask, because they think either it's stupid or nobody else wants to know. And trust me, they do want to know. So we are asking you, as our watchers or viewers, to ask the question. We would be happy to answer it. No question is stupid. All questions are welcome. It doesn't matter how vile you may think they are. Trust me, we've heard it before.
Yes.
The goal of this show is to educate women.
Educate women, empower women, learn to know your bodies, learn to love your body. Every body is different. Every vagina is different.
Every vagina looks different.
Labial is different. They come in all shapes and sizes, different colors. So don't be afraid. Don't think you're abnormal.
You're not. You're absolutely
not. Everybody
normal.
Looks like the porn star vagina.
Thank God. Cheryl and I have known each other since I started working in labor and delivery in 2006. So it's quite some time.
I know. We've been friends for a long time.
Friends for a long time. Watched each other through lots of stuff, personal and professional. Been each other's cheerleaders, and now we get to work.
We've circled through labor and delivery, and now we work in the office together. So it's kind of nice. And we, with all the calls that she gets in the office and all the information and questions that I get seeing patients in the office, we're like, let's just do this video, and hopefully we can educate women and inform you, and you can feel free to ask any crazy questions you want.
We welcome them, and that's why we're here. One of the things
the crazier the questions, the better our episodes are.
Yeah, more
entertaining. When did you start?
I started in 2006. I was a nurse tech to start.
And I started in 2003, so we've known each other since 2006.
Yeah.
And been buds.
Been buds ever
since.
So
we decided to empower women and do these videos. So if you like what you see, please don't be afraid to like and subscribe to our channel. We would greatly appreciate it.
And I'm hoping that you learn a lot. And as we progress through this, we really want you to ask questions that you think your mother should have taught you or somebody should have told you about you.
Yes.
First of all, we're going to start with the vagina's anatomy. Okay, we're starting with the vagina. Obviously, that's our focus. Many people don't know this, but there are 3 holes down there. One is the rectum. The second is the vagina. And the third is the urethra. All 3 of these belong to a separate body system.
And don't confuse them with the clitoris.
The clitoris is one of the most important parts of the vagina, and we'll talk about her in a moment. So if you have a problem with this, the rectum, you see either your PCP or a colorectal specialist. Don't come to us with that. Your urethra, whereas we do treat problems that are involved with urinary tract, sometimes they're above our specialty, if you will, and we will refer you to a urologist. The vagina is our specialty, and its surrounding areas. Cheryl had a really good point before we started. When we were talking, we really want you to understand something about the vagina, and that it is a big muscle.
Yes.
Talk
So
about
when I, especially young women, when I first do your first pap smear, you don't know what to expect, and that's our next episode: what to expect at your first visit and what a pap smear is and what we do. But you got to remember, the vagina is a muscle. You see all these muscles around it.
Let's bring over our pelvis.
We have a pelvis. So all these are muscles around it. So when you tighten up and you're really nervous and you're clenching, it makes it really hard for us to get that little speculum in there if you're tightening. So you got to relax so that we can get it in there. It's going to be much easier for us, and it's going to be much easier on you and less painful for you if you're able to take a nice deep breath and try to relax. Have a glass of wine before you come in. Although if you're underage, you can't.
Though, and we are going to do everything we can to make that exam comfortable. We'll use lubrication on the speculum. We'll wait till you're more relaxed. But understand, when you come to a gynecologist, you need to know that we're gonna more than likely look down there. We're going to need to do an exam, and you should be prepared for it. But moving along, there are many mysteries of the vagina that most people don't understand about intercourse. One is the clitoris. Obviously, you can have climax by clitoral stimulation. Men, we're not trying to start a forest fire down there, okay? Be gentle. She's gentle.
Yes.
The skin is gentle.
Rub her off.
No, you don't need to rub her off. And ask your partner what she likes. That's one of the most important things. The other part is the G-spot. Now, this is the mystery that many women, they don't know where their G-spot is. And Cheryl, you want to talk about that a little bit more?
Sure. The G-spot is located just behind and underneath in the vaginal canal. I think it's like 3 centimeters.
And this
Just
is
behind.
clinically proven.
Yes, and you can feel it. Usually there's like a smooth spot, and it actually is kind of part of the clitoris and goes actually down. Like, the clitoris is actually longer than most people think.
You mean internally it's
Mhm.
longer? Because it is a mass of nerves, is that
Mhm.
correct?
Mhm.
So understand the difference, and many women have a hard time climaxing during intercourse. So there are things you can talk to your provider about that. You're not alone, and it's not uncommon. In fact, it's more common than you even realize that not all women climax during intercourse. So if you have a question about that, please, we're going to give you a website or an email address where you can start emailing us questions about those kind of things, so that we can help you in the future about understanding your own anatomy better, so that you enjoy sex more.
So, when is the first time that you should come see an OBGYN, nurse practitioner, midwife, or get your first gynecological exam? You should come in when you are having sex, when you're 21, or if you're having sex before then, or if you're having any gynecological issues like irregular bleeding, irregular cycles, painful intercourse,
Burning,
itching, discharge,
foul odor. The vagina shouldn't smell. Okay, that is a common misunderstanding about the vagina. The vagina should never have a foul odor. Does it have a smell? It has kind of, yes, it does, but it shouldn't be unpleasant to the nose. So if your vagina has a foul odor, it needs to be evaluated. If your discharge is a strange color, copious amounts, which means large amounts,
frothy, yellow,
green.
gray, it smells like fishy, sour, musty. I had a patient recently tell me that hers smelled like baby vomit. Never heard that before, but everybody describes
Sour.
it.
That would be sour.
differently. So, yeah, if it's not your normal odor, not your normal discharge, please come in and see us.
At any age. I mean, and once we start puberty, chemicals in our bodies, hormones, change. Therefore, changing the chemical makeup of our vagina, and sometimes the vagina doesn't adjust as well to that. And you could have your first yeast infection before you ever had intercourse. Oh my gosh, yes you can. Yes. You could have a BV infection if you've never had intercourse.
BV is bacterial vaginosis.
Bacterial vaginosis. And it is a very unpleasant infection and can be very intimidating to someone who's never had intercourse, who suddenly has these symptoms going on, and you're afraid to tell your mom. Don't be afraid to tell your mom. It doesn't mean you're sexually active. We won't jump to that conclusion, but it does need to be evaluated, because I can tell you if it is something like that, it's not going to get better on its own. It needs to be treated. So make sure you come in for any of those kind of things that we've talked about. Abnormal bleeding at any age is not normal. It's why it's called abnormal bleeding. So people who are menopausal, I get this phone call a lot. I'm 50, I've been in menopause for 5 years, I'm suddenly bleeding. That is abnormal, and that needs to be evaluated. Because just when you're done having children and you think I'm in menopause, you're done with her, guess what? You're not. You're not done with her. She's not done with you. You could have a lot of other gynecological issues going on. And again, we're going to cover those things in our next episode about when you come into your first visits. In subsequent episodes, we're going to talk more about these topics like menopause and
Sexually
transmitted diseases and all those fun things.
And eventually we get to pregnancy too.
Yeah, we're going to absolutely talk about pregnancy and babies.
About a variety of things.
Yeah, but we're again introducing you with simply her.
Yes, basics.
One thing we want to make sure you understand that when you come into the gynecologist, we've heard it more than likely before. People stick things in there. That does happen. And we want you to know something, and similar to what Cheryl touched on earlier about your vagina being a muscle, and if you are using a sex toy or some sort of other kind of device for sexual stimulation and it gets stuck in there, I have to give props to a doctor I used to work with, Suzanne Milliken, who said this: your vagina is not Narnia. It's not like going into this wardrobe and it disappears into the abyss, into your vagina to travel upward into your brain. That is not going to happen. When you stick something in there and then you panic because you think it's stuck, obviously everything tightens. As you can see in the vagina, it's not going to go anywhere. The cervix is closed. Really the only thing that's going to get past that is bacteria. That's another episode. But if you have a device that you've used, it's not going to get lost. My recommendation to you is relax. Take a minute, take a few deep breaths. Attempt to remove it again on your own. If you are noticing you're bleeding while you're trying to remove it, which means you might be damaging the vaginal mucosa, which then can cause to swelling and cause further difficulty removing it, at that point then I would probably say you need to go see somebody, like in an emergency room, etc. But for the most part, anything you stick up there, you're going to be able to remove on your own if you follow those things. Stop, relax, have a glass of wine.
Everything's about wine. Wine makes
Glass of
everything
wine. Give yourself a few minutes, and relaxing is the most important thing. And then have your partner or try yourself to remove the device. And more than likely, once you do those things, you will be able to successfully remove it. The butt is another thing. If you do stick something in your rectum, again, not our area of expertise, however, we do know that that is a little more Narnia-like, where the sphincter muscles can and will tighten.
Colon here, do we?
And it can get stuck up there. And actually, I've heard of stories from the emergency room of people that I've worked with that they do travel upward. Mm-hmm. So the bottom line
colon
is
large. It
it's
goes like
large.
all the way. It's
all the way
descending,
around.
transverse.
And this is a side view, like looking at a woman from the side view. So, I guess the story is, Marlo's story, don't stick anything in your butt that you want to lose, because that's going to be a problem for you.
Yes.
Nothing in the butt. Again,
But you
only
can't get out.
use
Have a
devices.
string.
Yeah.
Have a emergency plan.
Have an emergency pull. Have an emergency pull light.
Pull cord.
A pull cord.
Yes.
But the vagina, more than likely, you're still going to get it out. Obviously, we don't recommend using things that aren't specifically designed for intimacy. Don't stick a quarter in there. Not a good idea. But again, you more than likely will be able to get it out if you do relax, take a few deep breaths. And at that, I think, anything else we want to add with this?
Well, and make sure for hygiene, make sure you wipe
Always
front to back. We don't want to introduce E. coli or bacteria from your rectum up into your urethra. It's a very sterile area, and you can get a bladder infection very easily if you, number one, don't pee after you have sex, because that introduces bacteria.
So always pee after intercourse.
Yes.
Because as you can see here, the entryway to the bladder, very short for a woman. Very easy for bacteria to run on up there and decide to hang out and cause a problem. Any bacteria that doesn't belong there, not a good thing.
We do treat bladder infections. You can also go to your primary care, urgent care. So it doesn't matter where you go. Just get treated if you have symptoms, burning, you urinate, or urgency frequency, bladder spasms.
Many times the urinal smell funny.
Yes.
And if it's an advanced urinary tract infection, meaning that you've ignored it, you may start to bleed from the bladder infection. And they can become complicated. So bladder infections must be treated. You cannot not treat them. They have to be treated.
They can travel up to the urethras and get kidney infections. You might have back pain, fever, chills, nausea, vomiting.
Any of those things you need to be addressed right away by going to an urgent care, because pyelonephritis, which is a kidney infection, can get serious very quickly, especially if you are a pregnant woman.
So if you have any questions about the anatomy, please don't hesitate to leave us a message or comment. We'll do our best to get back to everyone or address it in like a Q&A episode. And then when you are either having any issues, come see GYN, OBGYN.
Or a midwife, or a mid-level, another mid-level
Yes.
provider, which I'm not really crazy about that word. A nurse practitioner, a PA, physician's assistant, all of them are very capable of treating those things as well.
Whenever you become sexually active, you should come in and get screened annually for sexually transmitted infections, which we will talk about in, I think, episode 3.
Episode 3.
And when you're 21, that's when we start doing pap smears, which is the next episode.
And speaking of the next episode, we want to thank you for being with us today. I hope you learned a little bit something, and if you want to learn more, please shoot us a question. Remember, we're Wine Time with Women.
For women.
Thank you for joining us, and we look forward to you joining us again for episode 2.
Thank you.
Cheers!